Thank you so much for being here tonight. We really appreciate you and your time and want to welcome you to our weekly testimonial call on Thursdays at 5 p.m. Pacific Standard Time. I'm Dr. Caroline Williams. I am a functional medicine practitioner and I practice currently in Las Vegas, Nevada. I've been practicing for about 23 years. And I first learned about LifeWave about a year and a half ago, almost 2 years now. And it was introduced to me as a solution that I needed for a patient that was having a challenge that I really didn't have any other way to solve. And it was a major sleep issue, and it worked a miracle
She does have
for this person. And ever since then, I've been using it with patients, and I'm just grateful to know about it and to have it as again a tool to help people that are seeking better quality of life and better outcomes with their overall health, and including reversing the aging process. So, all right. So my co-host tonight is Nikki McCutchen, and she is a great team member. And Nikki, you want to go ahead and give our disclaimer?
Yes, thank you so much, Dr. Caroline. We are so excited that you all are here tonight. Just please know that someone really cares about you to want you to know about this technology and invite you to the call tonight. Our call will be for about 30 minutes, and if we have new people on the call, we're going to be talking about the X39 patch that activates this amazing peptide in our bodies. And hopefully Dr. Caroline will have a few minutes to answer your questions. Dr. Caroline is most likely not your doctor, so tonight the information we'll be sharing is for informational purposes only. If you have any medical conditions, please check with your physician or healthcare practitioner. All LifeWave patches are not intended to treat, cure, diagnose, or prevent any disease. If you're on medications or have a medical condition or are pregnant or nursing, please check with your physician first. Dr. Caroline, would you like to introduce Carrye to us tonight? Carrye, we're so excited to hear your story.
Yes, Carrie Putz, thank you so much for coming on the call tonight. Carrie has been my patient for, I want to say, going on 4 years now. And so we've gotten to know
November
each other.
2018.
Yeah. So, wow, that's like 5 years. That's
Yes.
amazing. Yeah. So, Carrie, I just love you to death. You're just such an amazing person. You've just been an awesome patient. And you were all open to like trying these patches, and I just can't wait to hear like what your experience has been so far. I know some of the things because we've talked about it when you've come in for your follow-ups, but yeah, I just excited to hear your story. So I wanted to know how have you been doing with the patches? What have you experienced thus far?
In June of 2022 is when I started with the patches, and I did the 15-day cellular regeneration protocol, which kind of like was to help me like jumpstart detox and get me going. And I continue to use maintenance, the X39, X49, the Eon, depends on how I'm feeling. I've noticed my changes have been subtle but significant. I have more energy. I feel better. And then let's see, when did we start? I think it was in the fall of 22, like August. I was diagnosed as hypothyroid. And I had been on Synthroid for decades, almost 3 decades. So after my experience in working with Dr. Caroline, I decided I wanted to get off the Synthroid and move to a more natural support for my thyroid. And as part of that, I did the LifeWave thyroid support protocol. And I've done well, and I have adjusted very well to the natural ecothyroid that I've been taking. And I think that's thanks to the Life Wave, and my numbers have been great. And as of today, I have no prescription medications.
Awesome, awesome. That's amazing. The other thing too, I know we talked about when you come in is when you would get your eye exams, some of the things that your optometrist talked about. I know one of the things that we were trying to prevent was an increase in cataract, and really just to try to maintain the health of your eyes and improve the health of your eyes. And we're using some nutrition for that as well, but
Right.
that's definitely something.
Yes, I had my annual follow-up in December,
Mhm.
and everything is great. He has a new diagnostic tool. It's called an OptioMap 3D, and they can go in and take a picture of the inside of your eyeball, and they can see your maculars, they can see your retina, your blood vessels, everything. And he was very pleased with what he saw, because there's no signs of high cholesterol, high blood pressure, diabetes. Everything looks structurally very healthy.
Excellent.
My retinal connections are great. There's no sign of macular degeneration.
Yeah,
And the cataract has not grown, not moved, and it's not ready for surgery. He says I have a
yeah,
long way to go. It's
that's
still
awesome.
just
That's
kind of there.
Yeah, exactly. Yeah, that's excellent. So, I know, like, consistently when we've checked your blood work, when we've looked at diagnostics, I mean, you've been really healthy overall. I mean, your metabolic panel's always been, for the most part, it's been great. Kidney and liver function's been really good. Blood sugar, for the most part, has been really good. You've just not had a lot of issues where those things are concerned. But definitely, consistently through the time that we've worked together, that's been the case, which is great because there really wasn't a lot wrong, right? There really wasn't
Right.
a lot of stuff that we had to improve. Like you said, the thyroid, that's definitely something that, we've always needed to work on. But you've always been really good about following dietary recommendations, and you've always been excellent with, any kind of supplemental recommendations. And now with the patches, in addition, I feel like the patches, if you've already been doing all those things for yourself, the patches just take things to a whole nother level. So yeah, so that's been excellent. And what about when you have been active, physically active, have you noticed a difference with recovery or strength or any of those type of things?
It's all improved. If I,
Yeah,
I'm using the X39, X49, I can do more. I can exercise longer. I really like the water aerobics, and I can do an hour of water aerobics, no problem, and a very short recovery time.
excellent. Yeah, that's great. That's
Yeah.
great. Well, good, well, good. Um, does anybody have any questions for Carrie
I
about what she's
do.
sharing? Yes.
Yeah. So, Carrie, tell me if I have this right. So, you've probably been on the patches for about 16 months. Is that right?
June 2022. Yes.
Okay. Awesome. So cool. And then, so a couple of questions. Did you notice anything like when you did the 15-day detox? So, that is one. And then another question I had, could you walk us through thyroid support protocol and where your patches went and what patches you were using?
I just did the thyroid protocol short term for like 6 weeks.
Okay.
And I just haven't needed them again, but I it's available, you know, if I think, but
So
my
where
numbers
did
and
those
everything
patches,
have been.
where did you put the patches, and what patches were you using? Oh, it's been a while since you've done it. Maybe you don't remember. That's okay.
No, it's on my phone, and it's like I can't get to my phone because I'm on Zoom. Did I write it down?
I can always share it in the chat as well, what I had her doing. I'll share it in our in the native send chat, that protocol that I had her
Perfect. That's
doing.
awesome.
Mhm.
Yeah.
Yeah.
Yes.
So then, did you notice anything like when you did the 15-day detox? What did you experience on that?
Like a improvement in energy, a lot of elimination. I had drank. You have to. That's one thing that I was cautioned on is drink plenty of water because
Mhm.
you do flush your system,
Yeah,
and it's like better sleep, deeper sleep. You know, my quality of sleep was better.
that's great.
Awesome.
My
And so
energy
then
level was better.
are you just wearing the X39 and X49, or do you also wear the carnosine for your eyes, or what are you wearing?
Um, Basically, I just use the X39 and X49 and the Eon.
Mhm. Yeah.
Yeah.
The
For my eyes, I that has been the bilberry supplement,
mhm. Yeah, the
and I
nutrition
think
that you're
just the
taking.
combination of the supplement and the way the patches have
Mhm.
worked for me.
Absolutely. Yeah,
Yeah.
that's awesome. Thank you so much.
You're welcome.
There is some evidence that the carnosine can help with cataracts. So I actually shared an article in our Native Son WhatsApp group the other day that was like a third-party article about all the benefits of carnosine, which there's a tremendous amount because it can help with the effects of glycation. So it can help with Alzheimer's, right? Anywhere you would get plaquing, it can help with that. So we get plaquing in the brain with Alzheimer's, uh, cardiovascularly as well, similar, right? Because that's actually we get plaquing in that area too. The eyes as well, but carnosine is also shown to benefit individuals that have cataracts. So I'll send that to you, Carrie, because I don't think I've sent that to you before, but I'll send that to you as
Yeah,
well
that
so you
was a
can
really
see.
good article. Thank you for sharing that, Dr. Caroline. It was really great. Yeah, and I
Yeah.
did notice that it talked about cataracts with carnosine in that article as well. Yeah.
Yes. Yeah. And I think it's great when you have third-party articles like that because we get a certain amount of education through LifeWave, but there's a lot more information out there that we have available to us in terms of how we can recommend this technology and these patches. Um, and I think it's good to, share that information so that we can see how many people that we can help, if
Yeah.
that makes
So
sense.
then, Dr. Caroline, how would the X39 and the X49 affect the thyroid?
I mean, the X39, you know, because it's a stem cell patch and because if there's damage to any area, there's damage to the thyroid, it can help repair that damage for the X39. And like a lot of times with the information that we share, anytime there's even any DNA damage, the X39 can help with that, right? So, and there's so many things that I'm not sure how much everybody's aware on here of this, but the endocrine glands are extremely sensitive to toxins, to chemicals, to whether they be, in our food, in our water, in our air. The endocrine system is very sensitive, and toxins can accumulate there because there's fat in those glands, for one. It's interesting. I don't know how familiar everybody is on here with Weston Price's work, but he lived in the early 20th century and he was researching like why indigenous cultures, their health started to decline dramatically after they started consuming what he called foods of commerce, which are, white flour and sugar and, all these refined foods. And what he, along with some other people prior to him, determined was the very first thing affected when you consume sugar is the endocrine system. So the endocrine system is one of the first things, right? Because that's the bridge between the nervous system picking up information. The next thing that's affected is the endocrine system. The hypothalamus is the bridge between the nervous system and the endocrine system, and that's your body's chemical messenger system to tell your body how to respond to anything. Your nervous system does its job as well where that's concerned, but your endocrine system is very sensitive. And so the thyroid is, pretty easily affected by things. And so as far as damage is concerned, the potential for DNA damage where the thyroid is concerned, especially over a lifetime, is the potential is high, right? So anyway, so the X39 can very much benefit thyroid function, in my opinion, and the X49 can affect metabolism, and the thyroid and the adrenals work together to create a person's metabolism. Those things work together, and so it's really important to maintain the health of those two things. You can't live without either one of those. You can't live without the thyroid, and you cannot live without the adrenals either. So they are definitely essential to life. And so that's why, if somebody's not making adequate amounts of thyroid hormone, that has to be replaced in some way, So both of those together work really well. And in addition to things that would help eliminate toxins. So then I would also be thinking, the glutathione is beneficial for that, right? So, and Eon is beneficial for any kind of healing capacity. I mean, that just sets the stage for healing to occur. You have to be in the right state for healing to happen. And that's what Eon does, is it gets you into that state. So that really plays a significant role there. And that's why a lot of times when we get questions about what patches to use, almost all the time you will see me say Eon as one of the patches, because it decreases inflammation, it sets the stage for healing. Even children, right? They can benefit from the Eon. You wouldn't necessarily use all the patches with children, but definitely the Eon is a great one for sure. So depending on the situation, right? But so those patches are very beneficial. The energy enhancer, I feel like, could be beneficial as well for the thyroid, because again, it helps with that converting fat into usable energy, and it's going to help activate that effect. And so it's beneficial for the thyroid as far as the energy enhancer is concerned.
Dr. Caroline, I just sent you the protocol that I used. And I used the glutathione, X39, carnosine, and Eon.
Okay.
And then a 5-day energy enhancer detox.
Yes. Okay. I'm going to share it here. Give me 1 second. I'm going to just send it to myself really quick, and then I'll share it on there so that you guys can see that.
So you found your thyroid protocol that you did, Carrye.
I'm sorry?
Was that you found the thyroid protocol that you did?
Yes.
Okay.
Yes, I did.
Yeah.
So, and they're all, most of them were like on the head and neck, the patches.
Oh, okay.
Yeah, I'll share it with you guys.
And you said you did that protocol for how long?
Several weeks.
Okay.
Because, you get the packet of the patches, and I just used them until the patches were gone.
Oh, okay. Very good.
I've used that protocol with a few patients. I've alternated it with a protocol for the endocrine system as a whole. And I've done that with a few people. Let me open that up and share it here.
Did you notice anything? Did you feel anything, Carrie, when you were wearing those patches?
One of the things that is, and it happened when anytime I adjusted my thyroid medication, I get a lot of sinus congestion, a lot of congestion. Don't really have a cough, but it's just a lot of mucus production in my sinuses and in my it's all in my head.
Mm-hmm.
And so
Yeah, so
that
can you,
that was affected during while you were doing the
Yes.
protocol?
Yes,
So that got
it's
better.
part of like a detox for me. It was just
Yeah.
detoxing and
yeah, can you guys see the screen? I'm sharing it.
Yeah, we can, or I can see it.
Okay. Yeah, I mean, mucus production is a detox response. And not everybody's necessarily familiar with that. A lot of people think mucus is just pathogen related, but it's actually toxin related as well. So a lot of times when people will start a detox, they'll actually produce more mucus temporarily to mobilize toxins because, you know, when you're detoxing, you are activating, moving toxins out of storage areas. And so many times you'll actually produce more mucus to do that. And so that's definitely a detox symptom, especially if you haven't changed your diet or done anything like that, you know? Yeah. So you can see the two glutathiones, one at the sternum or the episternal notch, and then down below the belly button. And then X39 is on the back of the base of the neck. Carnosine is on the left side of the thyroid and Eon is on the right. And you're doing 5 days of the detox energy enhancer only. So when you know that severe symptoms protocol, the energy enhancer recommendations for that, that's what you're doing for 5 days. Mm-hmm. So, yeah.
Very good. And can you tell us, Dr. Caroline, a little bit about like not being afraid of the detox symptoms or how the how the detox is actually good, whereas some people it kind of freaks them out when they're having a detox symptom.
Yeah, I think the freak out is probably just not understanding that it's necessary. That anytime you're detoxing, you should experience the effects of that. That's evidence that it's working, number one. And it's always temporary. Things are always changing, right? And so how I describe, and I did this earlier with someone today, how I describe detoxing is you start at, you're starting at baseline, and when you start the detox, you start climbing up, right? You start moving up in terms of your symptoms, and then you'll hit a point where you'll peak. Those symptoms will peak, and then you'll start going down the other side. And that's the same with detoxification as it is with clearing a pathogen. You go through the same process. A lot of what we've learned today through, conventional medicine's influence is that that's not normal, maybe. And that if you are experiencing that, then you need to suppress the symptoms of that. But yeah, I disagree with that. You really just need to go through it, and you can do it in a way that is tolerable for you as an individual. If you were experiencing nothing and you were doing these things, then I would question what was even happening, So the fact that you're experiencing the detoxification, which you should be, and we can do it at a tolerable level, it's something that you want to embrace because it means that change is happening, and you're not going to experience that forever. It's a temporary experience. When you get on the other side of it, you are truly better. You've truly you've truly improved your the state of your internal being. You've truly improved it. It's not an illusion where if you just take something to suppress your symptoms, you might feel better, but you're not actually better. Like all that is still there. And so you want to allow for that, is my opinion, to really make progress, right? Yeah. Yeah, Pastor Ed.
Yeah, thanks, Carrie. What a wonderful testimony you've given us. I like to, and I've been in the company for 2.5 years, so I know how wonderful this product is. But what you described to us, it almost sounds too good to be true. Okay, so I'm gonna play the devil's advocate. No pun intended, please. But I want to ask you how, and I'm gonna miss this, but to check your thyroid to know that you were feeling better? Were there any tests or exams that Dr. Caroline did on you?
Yes, we did a full blood panel,
Okay.
and that included, T3 uptake, T4. There were several instances of that.
Yeah.
Okay. Now I know how one.
And just physically, my skin was not so dry. It was clear. My hair was thicker. That's where I can usually tell if there's my thyroid is off, is my hair and my teeth.
Mm-hmm.
And so I could tell I was not shedding my hair as much. My hair was much healthier, and even the person that cuts my hair had asked me if I had changed shampoos or something, or if I was taking some new vitamin, because my hair was noticeably different.
Wow. Yeah, thank you for sharing that. I know how wonderful Dr. Caroline is. Before her, how long have you been dealing with your thyroid issues?
Oh, close to 30 years.
Wow. So you mean to tell me within 3 to 4 weeks, you're a lot better. It shows by your blood panel. That's just amazing. I'm just
actually, I did the patches for 3 to 4 weeks, and then I was transitioning when I first stopped the Synthroid and started taking the ecothyroid.
Mm-hmm.
Wow.
Yeah.
Thank you so much.
Yeah, we do regular panels to see where her thyroid levels are at, and we're checking, TSH, T4, free T3, like she mentioned, T3 uptake. We're checking all of those things on a regular basis to see where things are at, and she's just done really well with her thyroid, especially with that transition, because the patch use, along with switching her from a synthetic thyroid replacement to a glandular thyroid replacement, that's what we did. And so, yeah, she's done really good with that. And all the symptoms she mentioned are hypothyroid symptoms, like dry skin, hair loss, fatigue. There's many others besides that, but her hypothyroid symptoms improved. That's something that a lot of people don't know too, is when you're taking this synthetic thyroid replacement, your numbers could actually look good with testing, but you could still have hypothyroid symptoms. You could still have the dry skin, you could still have the hair loss, you could still have things like that, even though your numbers look okay. And there's nothing like the human body in terms of, our body's our best pharmacy, that you're ever going to have. And us trying to consciously do the thyroid replacement like our body just does naturally, it's like we can't compete, you know? So, you know, anything that we can do to help support the body's own production of things, that's one of the reasons I have to say, you guys, I love these patches for that reason, because they're not putting chemicals or they're not putting anything into the body other than light frequency. That's it, you know? So they're stimulating your own production of things, which again is superior to an exogenous approach. It's superior. So like, you know, even the article I shared the other day with the group on carnosine, you know, he was recommending in their carnosine supplements. Our patch is so much better than a carnosine supplement. It's going to work so much better than a carnosine supplement. And my whole thing is like, that's what these doctors need to understand or know. Cause I mean, they probably be recommending the patch too, but they just probably don't even know that it exists, honestly, you know, or else they'd be all over that, you know? So, the patches are truly amazing what they do, and they work with the innate intelligence to help us produce our own, you know, physiology, to help produce the things that our body can produce, right? Like we don't need exogenous forms of these things. So it's pretty amazing.
And I just want to clarify too that I had done the 15-day cellular regeneration protocol a couple of months before I did these. I started my transition from the Synthroid to the ecothyroid, and that's so I'd already done that part before I did the thyroid protocol. So I think I was set up for, you know, success.
Yeah,
by doing that 15-day, because that was it's pretty intense to me. You know, there's 5 patches you wear during the day and 3 at night, and
yeah, you're definitely wearing a lot of patches, which is good, but that's really, like you said, that's the point, is to, it's like hitting a reset button. So, you know, I wanted all of you guys to go through that process before we moved on to any of the other more specific protocols, because I did feel like it would increase your success rate. You would notice a difference faster that way. Yeah. All right. Well, anybody else have any other questions tonight?
Dr. Caroline, did you want to answer Sandy's question that she had texted you?
Yeah, Sandy, do you want me to talk about that a little bit?
Sure. Steve's been wearing the patches faithfully, but we just wanted to kind of know if there was a different placement to be working on. He's lost, how much weight have you lost, Steve? 22 pounds.
Wow, that's
The last
amazing.
3 months.
Wow, that's great.
And he's on a new injection called Trulicity. It's not insulin, but it's to help protect his kidneys.
Okay.
And his glomerular filtration rate is only 32. So our hope is to maybe reverse that kidney damage. And there's been such great testimonies with LifeWave that Steve wanted to make sure he was putting them on the best places for him.
Yeah, the other, in addition to the 39 and Eon, I would actually look at carnosine that we talked about earlier, because when there's type 2 diabetes involved, the effects of that is what can damage the kidneys, right? So the type 2 diabetes effects is what could damage the kidneys, just like it could damage the eyes or other aspects. And so carnosine is really the one to help with that type of damage. I mean, X39 too, because that helps with any kind of damage. But the carnosine would be a good one when it's related, in my opinion, to type 2 diabetes. So the carnosine would be excellent. I can send you a protocol for the kidneys.
Okay. His
Yeah, and
household uses the X49 real regularly.
mhm,
So those three he uses real regularly, 39, 49, and Eon.
yep.
And the carnosine we've been putting that on his lower leg to heal up that ulcer.
Yeah, how's that going?
How's that going, Steve? Is it scabbed over? Yeah. It's scabbed over now. So yeah, that's
Good.
for months it wasn't scabbed over. So that's a really big improvement.
Yeah, that's great. That's great. Water consumption, fluid consumption like water is really important. That one's really important. In addition to the patches, just because of how it affects the kidneys as well. Do you know how much water he's consuming? Like how many ounces a day you think?
Steve, would you say you're drinking 2 quarts, 3 quarts? Probably 2 quarts of water and then sometimes a little sparkling water. Just
Okay.
plain, like with some lime or something in it.
I gotcha. Okay.
Between 2 to 3, I'd say 3 would be a good day. 2 would
Okay.
be average for him.
Yeah, because with any time you're trying to work on improving the health of the kidneys, we want to make sure hydration is there, that you're consuming enough water for the cleansing process to take place. That one's really important too. So yeah, I'll send you recommendations on that as well. Does he drink anything other than those two things? Does he drink coffee or anything like that?
And he has coffee maybe on Sunday. He'll drink lactose-free 2% milk, maybe
Okay.
a cup a day,
Okay. All right.
but
But
that's
yeah.
about it.
Okay. All right. It just helps me to know. I mean, if he's just drinking it occasionally, that's okay. If it was a daily thing, I would say we might want to look at that just temporarily, not doing that, but it doesn't sound like that's the case. So
No coffee. What about tea? Tea too? No tea?
yeah, I mean, it's just those. I've noticed a difference even with myself. Like I stopped drinking coffee. It was a recommendation from someone else that was looking at my skin specifically, and they were saying, "Yeah, I can tell you're a coffee drinker." And my skin was very dehydrated chronically, and I had other symptoms of dehydration too. And so I went ahead and just gave up the coffee pretty much totally. Occasionally I might have some, but not on a daily basis like I was. And it's just like within probably the last 3 months, my skin is just completely different. My skin is different. Yeah. And so kidneys are very affected by dehydration. I don't know if you guys are aware of this, but the number one cause of kidney stones is dehydration. And so that's just a good example, right? And so hydration is just extremely important for the health of your kidneys. And you want to certainly look at how much water you're consuming, but you also want to look at things that are dehydrating, Yeah. So it really can make a difference just to cut out those things. It just can be like night and day, truly. Yeah. So, but it doesn't sound like he's doing those things, similar to like if somebody was drinking alcohol, even socially, if they were doing it weekly, it's gonna take a toll, But if he's not doing those type of things, that's good because it's just we don't have to worry about that. We just want to increase the water consumption for sure. But I think that he's using the carnosine on his leg. I think it's great. I'll send you a protocol for the kidneys.
Okay.
And but the carnosine is definitely one of those things that can help besides the X39 can help repair the damage that the effects of type 2 diabetes causes.
That's awesome.
Mm-hmm.
Because he's had the diabetes for probably 15 years. So
Mm-hmm.
quite a while.
Yeah.
So
Right,
we
yeah.
can just start by preventing it from getting worse.
Yes,
And
and
then,
yeah, and you can reverse the effects. That's possible. Obviously, it sounds like he's already done a lot to help, like losing that weight helps a lot, that can help a lot. And if he can maintain a healthy blood sugar, that's key, right? So that more damage is not occurring.
they
Yeah.
were, for several months, they were trying to mess with his medicine and it was staying at like 275 to 300. But when you say, is it averaging what, 150? Maybe 170. So like 100 points low is huge.
Yes, that is huge. That is huge. Yes. Way better than where it was, because
Yeah.
that high you're talking about in the upper 200s, 300s, damage is for sure occurring at that level,
Right.
So the fact that it's dropped down as much as it has, that's extremely helpful. Yes.
So yeah, so those are some really big improvements and we really
Mhm.
appreciate all of the patches and the input regarding that.
Yeah,
And
no, that's great.
you were gonna send me some information. You had said, so you had some ideas on some other things to help.
Well,
with
one of the things, yeah, in addition
changes.
to the LifeWave patches, infrared light is very beneficial for wound healing. I have a video that shows that. They were using the red light, or not just red light, because there's red light for collagen production, and there's near infrared for wound healing. And the near infrared, they were literally using it on people who had gangrene in like their toes, and they were scheduled for amputation. And just with a short use of the near infrared, and they didn't have to have their toes amputated, the blood flow came back and the repair happened and they were able to keep their toes. So it's pretty dramatic. Yeah.
Wow.
So in addition to the patches, something like that, you would apply it directly to the area though, the near infrared. I have one in my office that it's called a Soluma, and it emits blue, red, and near infrared, those three lights. And you can just put it on the near infrared setting, and then you just put it over the area that you want to promote the healing. So that, in addition to the patches, it would just take things to a whole nother level. And you could use that daily, actually. I know in my office I would rent it out to patients so that they could use it daily. Instead of coming into my office every day, I would just rent it to them. um, so I would think it was more affordable that way too, because I just charged like for the month or for the week instead of for per visit. So it was a little bit more affordable. Yeah. And then somebody could always, like, if they just wanted to try it out and use it, they could do it that way. The other thing is they could just buy one for yourself, because there's like units out there now that you can buy, and they're portable. It's not like you have to buy some big piece of equipment. It's just a small thing that will fit around the area, and it's totally affordable. But that would also be helpful for wound healing.
Okay.
Yeah.
Um,
But I'll see if I can find the video, because it's only like 15 minutes. And
okay,
it's
sure.
yeah.
You were gonna, I don't want to take up time on this call, but you were gonna send me some information that you had in mind to help me with all of the nausea and the diarrhea and the stuff that I
Yeah.
had gone through, and it was some different things, so different topics.
Yeah.
Thank you
I'll
so
send you
much.
some information. Yeah, I want to send you some information on, because I know we talked about PPIs and the effects of PPIs.
Yeah.
Proton
I'm
pump
done with it
inhibitors.
now, and I'm still having gastric reflux, but it's not as
Okay,
bad.
not as bad.
But I
Yeah.
took 6 weeks to wean off of that, so it's quite the ordeal.
Yeah, I'll send you, can you do something for me? Can you send me your email again, your email address again, because I'm going to just email you some questions and I'm going to send you that video and I'm going to send you some information on PPIs just so you understand how some of what you've experienced could be related to that, you know.
Would that Soloma, Nikki, do you know, would that be the same light that Lori Wood has and uses all the time?
Oh, it's different.
It's different.
Yeah.
Yeah, hers is a PEMF, which is good as well. That one's great, but that's different. But that's beneficial too. It's just for wound healing. Well, you'll see, because in the video they show it. I mean, they show like case studies in the video, like this was before, this is after, and this is how much they used it over this period of time. So you'll see that, you know, with the PEMF, it helps you in a different way. And definitely beneficial as well, but just in a different way.
Okay. Okay.
So I'll email you those things.
Awesome.
Yeah. Well, thanks for being on the call, everybody. Carrie messaged me, so she said she lost the connection. So yeah, I appreciated her being able to come on the call tonight and share her experience. And I'm excited to see her results in another, 2 to 6 months, with her eyes, with her eye health, and as well as her thyroid. But she's been such a great patient. Like, she really has not had a lot of, her diagnostics look pretty good overall for the most part. So we just want to keep her in great health is what we want to do. All right.
Absolutely. Thank you so much, Dr. Caroline, for tonight. We really appreciate it. And we so appreciate all of you being here. So thank y'all so much for joining us tonight.
Thank you. Thank you, Dr. Cap.
Thank you, everyone. Good night.
Good
Night.
night.
Dr.
We'll see you
Caroline.
next week.
Thank you, Nikki.
Thank
Night,
you, lady.
thanks.
Good night. God bless.
Have a great evening.
You too.
Good night.